Spina bifida happens when a baby is in the womb and the spinal column does not close all the way. Every day, about 8 babies born in the United States have spina bifida or a similar birth defect of the brain and the spine. In Africa, this condition is worse than that of the United States. Spina bifida can happen in 3 phases, namely occult spina bifida, commonly known as OSD, and in this, infants have a dimple in their lower back. Children with this might grow up but might find a problem with their spine as they grow up. Spina bifida occulti is also called hidden spina bifida. In this, about 15% of health persons have it and do not exactly know. This can only be known after going through an X-ray scan. The third phase is known as the meningocele. This occurs as part of the spinal cord to come through the spine like a sac that is pushed out. Nerve fluid in the sac is there and usually no nerve damage is made. Individuals with this condition may have minor disability. The fourth condition is known as Meningomyelocele, also called Spina Bifida sciatica. This is the most severe form of spina bifida. It happens when parts of the spinal cord and nerves come through the open part of the spine. It causes nerve damage and other disabilities. 70 to 90% of children with this condition also have too much fluid in their heads and the brains. This happens when fluid that protects the brain and the spinal cord is unable to drain like it should. The fluids build up, causing pressure and swelling. Without treatment, a person's head grows too big, and this may have damage on their brains. The condition makes the nerves of the body to bend into opposite direction. Minor spina bifida, mainly that of the feet, can be treated, as Richard Butter, an orthopedic, explains.
Plastering of the feet, in most cases, we are opposing this deformity. So, in the long run, you find the foot which is looking this side, you put it back to its normal position, so that by the time the kid is walking, the foot is in its normal anatomy. So, the child can walk properly. Yeah, that's why we put this plaster to keep it in position. If the child is growing, then you find the foot is growing in its normal anatomy.
Commonly known as big head, children like her go through a hard time, mainly in school. Though these can be treated and able to fit in society, the difficulties that they encounter are also immense.
Those cells, they keep on producing a fluid which is called cerebrospinal fluid, and that fluid has to pass through some pathways. As you will see that within our muscles we already have some veins, but it's still the same case that in the brain we also have some pathways. Those pathways are responsible to let the flow of the fluid through the spine, and then it can be let off like sweat, like urine. But you'll find that if those pathways within the brain are blocked by the infections I talked about at first as the main cause, you'll find that they are blocked and the water just keeps on accumulating on the brain.
These children go through a hard time of life and are unable to enjoy life like other normal children.
It is very important if the child can be rushed for an operation so that we can prevent a brain damage, what we call cerebral palsy. So once they have done the operation, immediately the child can be started on the rehabilitation services, among which is training, sitting, standing, and walking. When the child learns walking, some of the hydrocephalus kids can even go to mainstream schools. They can go to the same class among which are other kids without disabilities.
Caretakers of some of these children explain to us what they go through while taking care of the young ones with such a condition.
Kubanga omwana batasobola kwekolera kintu kyonna, tusaba muyita mu buli kaseera. Kati ngono namuzaala ebigere nga byegase bwe bati nga tasobola kwambala n'empale, naye kati badokita ne basobola okusikagana amagulu, kati empale asobola okujambala. Bingi nibwo bw'olaba ng'obeera n'omwana nga teyeeyamba.
Namuleta nga amagulu tegeekunya, namuleta era nga yali bubi, naye abasawo bano bakatali kakasa nti batakumuwonya. Kuba nange nalindyawo nga nange obuzito bw'omwana bundemeredde. we bajja ne bamuyamba.
Persons with spina bifida must learn how to get around on their own without help. These are helped by using crutches, braces, or at times wheelchairs. When asked, can spina bifida be detected before birth? Physicians state that a blood test during the 16th or 18th week of pregnancy can be carried out. This is called the alpha fetoprotein, commonly known as the AFP screening test. This test is higher in about 75 to 80% of women who have a fetus with spina bifida can be detected. An ultrasound scan of a fetus, commonly known as a sonogram, can partly show the signs of spina bifida, such as an open spine during pregnancy. A test where a small amount of fluid from the womb is taken through a small thin needle in a test known as maternal amniocentesis can be used to look at the protein levels in a mother's womb. However, what to note is, parents should know that no medical test is perfect. The tests that are made are not always right and can be trusted. Philemon Chirabo, Top TV News.